Welcome to the Trending Today podcast, the extension of our award-winning television series airing on Fox Business, Bloomberg, and A&E. I'm your host, Lauren Hubbard, and today's guest is someone redefining the intersection of healthcare, access, and impact. Jennifer Lockwood is the founder and CEO of Ravin Consultants, a 100% woman-owned company that's become one of the leading authorities on the 340B drug pricing program. Her team's mission? To help healthcare organizations serve vulnerable populations while staying financially strong. Jennifer, welcome to the show.
Thank you. It's such an honor to be here with you again.
It's so exciting to have you here. We're going to talk about grants, the current administration, what the 340B program is, what Ravin Consulting is. Let's go.
Okay, let's dive in.
Oh, okay. I'm super excited about this because your origin story and how this whole concept came to the concept of inspiration and the name of your brand. Let's start there. What is Ravin Consultants, and where did the name come from?
Ravin Consultants is spelled R-A-V-I-N, which in that manner means to aggressively and dominantly go after your prey. My prey in my organization is Big Pharma. It's to get them to give discounts to my nonprofit organizations so that they could use those resources within their community and on their patients.
I mean, that is a game changer. To name your consulting firm after that and then to go after Big Pharma. We're not talking about, the guy next door. We're talking about multi-billion...
Trillion
industries. As a woman, I applaud you.
Thank you.
As a CEO, I bow to you for paving the way. You're setting a precedent for what women in business and leadership roles can do, and I thank you for that.
Oh, thank you very much. I really appreciate that.
So are you ready to get started?
Yes.
Okay.
Yes.
What is the 340B program? Can you tell us a little bit more about that?
Absolutely.
Okay.
So this program was created in 1992 by Republicans, but then later expanded in 2010 by Democrats. So that's huge. To be bipartisan, that just means that it's a vital program that is absolutely necessary.
Voted on by both sides of the parties, pushed all the way through since 1992. Okay.
Yes. So what Big Pharma is required to do if they want to be in Medicare, which clearly Big Pharma wants to be in Medicare, that's where they have most of their drugs.
Right.
They have to be in this program as well. What they need to do is give discounted pricing. So the best way to do it is to give an example.
Okay.
Let's say you go to the hospital or you go to a doctor's office and it's not 340B. They find that you're diabetic. You need to be given medication. Okay. You go to a pharmacy, you pick up that medication. The pharmacy bills your insurance for, say, $1,000. They have to pay Big Pharma or the manufacturer $900 for that medication, and they keep $100 for the dispensing fee.
Okay.
End of story. Okay, now let's enter in the 340B program.
Okay.
Now you're a 340B eligible patient, which you may or may not even know, going to a 340B location, which you may or may not even know, as well as going to a pharmacy, which all of this is in the compliance and why it's such a complicated, intimidating program.
Yeah.
But once you go to that pharmacy, that medication is now going to cost $600. However, my pharmacy is still going to bill insurance for $1,000, pay Big Pharma $600, now not $900, keep their $100 dispensing fee. Now there's $300 on the table. That's going back to my organization so they can put it back into patient care, patient assistance plans, food pantries, better machinery, whatever the community and their patients need, they now have this grant funding, the resources, the money that they need forward.
Okay, we love this. We love this. So it's putting money back in the pockets of people, creating access to those who need it, and so on and so forth. So we love this.
Yes.
What are eligibility requirements for the 340B program?
Oh, there's a lot.
Okay. As an individual, let's start there, and then maybe as an organization.
So as an individual, you would have to be credentialed or contracted with the organization. So if you are a doctor, you would have to have an employee contract or a 1099 or some type of contract that binds you to that organization.
Okay.
Now, the organization is who holds the actual 340B eligibility. different designations. So they're in two different groups. Grantees, which are typically your nonprofits who may see hemophilia, Native American, tuberculosis, Ryan White, HIV, STD programs, and then there's a few more. Then you have your hospital side, which are also your nonprofits, your critical access, your disproportionate share hospitals, which see a higher percentage of indigent patients. All of those organizations are automatically qualified if they meet certain restrictions, and each designation is different. So once they meet all those qualifications, then bam, you get to go right into the program and receive all these discounts on medications, which typically averages about 50% off.
No way.
Yes.
That's transformative for anybody.
Anyone. And these organizations are using it to purchase new EKG machines, new MRI machines, to have patient navigators to remind their patients of appointments, to pick up their meds, to see if they're having any symptoms with their medication, to see if they can afford their medications. Do they need assistance with copays, deductibles, premiums? That money is now in a bucket that the organization can say, we can help you. Don't worry about this. We can help you.
And this money is not taxpayer money.
No, it is not.
So
it is all discounts from the manufacturers, Big Pharma.
And I'm wondering, is it under attack or in question if these resources will be there depending on the current administration that's in office?
The current administration has been making it a little bit challenging for certain segments, such as Ryan White with HIV and the prevention. We've also, though, have always been fighting against Big Pharma. Doesn't matter the administration. It is always against Big Pharma. Hence, again, the name Ravin. So they're always wanting to change the program from a discount to a rebate, or in 2020, as if we weren't going through enough with COVID in the medical industry.
What happened in 2020? I have no idea.
Oh, yeah, exactly.
What do you mean?
As if we weren't working endless hours during COVID, they decided at that point to make restrictions. And the restriction they made was to limit the amount of pharmacies that we're allowed to use. They want us to be able to use one pharmacy for every single organization.
One pharmacy.
So you might like CVS, you might like Walgreens, you might like Publix, you might like a little tiny independent store, but they were only allowing you to use one. So we've been fighting them since 2020 to open the doors to allow patient choice of wherever they want to go. An HIV patient may not want to go to a big box chain. They may want to go to their small independent pharmacist who knows them, knows the disease that they have, and knows how to care for them in a proper manner. So we're still fighting to this day on limiting the contracted pharmacies.
Okay, so we're not going to lose any access to the 340B program yet. So that's good news. Why is this so important to you?
It's important to me because the first client, who was not even a client, she was just a colleague of mine who I knew in the industry. And I happened to be in her area, and I said, "Did you ever get this program started?" And she said, "No, I'm eligible for it, but I have no idea what the next step is. And I also know if I don't follow the compliance that I could be in big trouble because it's a federal program."
Yes.
So I went to her actual establishment, and I couldn't believe the location that I walked into. I genuinely was afraid for my life because I thought the roof was going to collapse on me. The entire structure was dilapidated, and something inside me clicked at that moment. I said to myself, too many organizations are like this. Too many nonprofits are not being profitable, are not having reserves. You have to be profitable in a nonprofit. I know that's in the name nonprofit, but you have to have reserves, such as like when COVID hit, such as when recessions hit, such as when anything hits. You have to have those reserves.
Yes.
So I was able to get her into the program, eligible, implemented everything, got everything in compliance, and now that organization is thriving. They are in a brand new building that they bought. They opened up a medical clinic. They opened up their patient assistance. They have a mobile unit to go around and do testing on. I mean, they went from having 10 to 15 people in a building that I was afraid to be in, to a beautiful, zen, relaxing, beautiful place that patients can come in and feel comfortable in and get the services that they need. So that's why I started it. I wanted to work around the country, seeing as many patients, as many clients as I possibly could, and get the word out about this program and just advocate for it.
This is incredible work that you're doing, especially as like a one-woman show out here saying, I'm going to go after Big Pharma. I'm going to even name my consulting firm as the aggressor in this and say, you're going down and here I come. Like, I'm blown away. Okay. So we talked about 340B. What are some common mistakes and missed savings in under-optimized 340B programs?
So you'd be surprised. Some people have been in this program since 1992. Many have been in the program when it expanded in 2010. That's 15 years ago. So they're rolling and just thinking that they're doing the program in the most optimized way. And they're actually not. We have been going into all of our clients. And we start with the foundation of ensuring their eligibility is correct, implementation is correct, and of course, compliance is correct with the federal program. But then we like to outsource it even more. Where we are seeing the underutilization is in capture referral, which means, let's go back to that diabetes example that we had. If you're coming to see me and I diagnose you with diabetes, but I don't treat that, it's not my specialty, and I refer you out.
Okay.
When you go to the referral and pick up your prescription there, as long as they don't have their own 340B program, I now can capture that referral through prescription and bring it back and have that margin underneath my own organization, even though you went to another provider because I referred you to that provider. People are missing out on millions of dollars and giving it back to Big Pharma. Big Pharma has enough. Bring it back to your organization. And then again with Big Pharma, since 2020 with the manufacturer restrictions, they did allow some items to go through, meaning we now have to use a portal called ESP. And we have to go in and put all of our claims in there that we say these are what we should be paid out on. And we have to have them bless it now, which is a little ridiculous. But if we want to make the money, we have to do it that way. We are still seeing that covered entities are not using this platform in order to carve in those dollars.
Okay, so wait, what do these organizations, number one, know that this resource is here? Maybe that's why there's access Maybe that's why they're not utilizing the platform?
Possibly. So it's, you don't know what you don't know.
Yes.
And nonprofit world, usually you don't have one job. You have 1, 2, 3, 5+ jobs.
Yes.
So to learn a whole new software and a whole new program, all new compliance, writing all new policies and procedures based on this new platform, a lot of them just don't have the resources to do that. That's where Ravin can come in and we will do it for you.
Aha. Now it's all
Yes,
make it
same with
make
capture
sense.
referral. You would have to change your compliance, change your policies and procedures, change your operating flow, look at your data differently. Again, that's something at Ravin that we could do that for them so that all they see are the dollars coming in so that they can focus on their mission while we focus on their margin.
And put the money back into the community where it's meant to
Yes,
be.
exactly.
Oh my gosh. Snaps for you. This is so cool. No, I really am passionate about nonprofit work, advocacy. Like, this is for me, this is kind of like sitting in a masterclass lesson with you, learning firsthand at what is possible from someone who just started with an idea to help someone else.
Mm-hmm. Well, I love that you said that because one of my core missions was to become the first teaching firm in the 340B industry. Not only with my clients, but with my own staff. But with my clients, we were virtually remote before COVID was a thing.
Okay.
So it was our norm. So during 2020, 2021, we were teaching everyone to unmute themselves, how to position their camera. You know, all those days, nope, can't hear you right now. But we had already started doing that. So one of our favorite things to do is to share our screen and real time show you what we're doing in all of our programs, in our program management, in our shared drive, in the third-party administrator portals, anything so that they are learning and seeing exactly what we are doing. Because this program, I've been in it for 15 years and I'm still learning things every single day due to all the policy changes, due to rules and regulation changes, just anything changes. So they're able to kind of keep up with us so they feel empowered themselves.
Yes.
But not only my clients, I love doing it with my own Raveneers, which that is what we call them. We are the Raveneers, which because we feel that we are the pioneers of teaching the 340B to the industry.
Let's go.
So, yes, I typically don't call them staff or employees or teams. So if you hear me say Raveneers, I am talking about all of them. But it is big to me. And maybe this comes from being a woman-owned, women-led company that I want to empower them. I want to pay for their certifications, their licensures, extra education. I want to help them get into the next role and be promoted. And I've been doing that with my current COO and principal, Rob Ferraro. He started with me about 7 years ago as a chief pharmacy officer, was promoted to chief operational officer, and just this year was promoted to principal. So he's now taking on a lot of my duties. And that's what it's about. I did not do this to be in this for 30, 35 years. I want to do it, perfect it to the best of my ability, and hand down the baton to someone else and still stay in the shadows, which I prefer, and help out where needed, but to really give that experience to someone else to take over.
There is nothing about you that is ever meant to stay in the shadow.
Thanks.
And the light in you is so bright that it is meant to be seen. And that is why the universe has you here doing the work that you're doing.
Oh, thank you.
I mean, truly, you have to know this. You know, to hear about you talk about your team and the Raveneers and creating that culture and passing on the baton. As women in leadership, it's really about being the mama bear.
It is.
And bringing everybody home. You know, we're all going to walk the path together.
Mm-hmm.
We don't want to do it alone. We didn't come here to do it alone.
No, and that's the one thing that I do love about being the woman-led is that not only is there mama bear, and my job is to protect my Raveneers protect my clients, and my clients protect their patients, but I'm also the grizzly bear who protects my Raveneers and ensures that my Raveneers protect the clients and the clients protect their patients. Because there's two types of protection. The protection like that the mama bear is keeping them happy. We love having team days and strategy days where I hear everyone's voices from the COO to the executive assistant to the accountant to the marketing to the HR. I want to hear everyone's voices of what we're going to do in the next year for our goal for Raven Consultants. And then you also have the protection of the grizzly bear who is like, no, we're not going, don't poke the bear. Don't poke the bear. Don't poke their bear because my kindness does not equal weakness. I will absolutely protect and advocate and make aware of everything that is going on. So definitely the mama bear and the grizzly bear with the women-led, women-owned, I think is a wonderful combination. It is.
It is. And you're, it's so good. It's so good. Okay. Can you give us an example of a client success story?
Absolutely.
Okay.
So we've had this client come in about 3 years ago, but they were already in the program for several years.
Okay.
Kind of like I stated before, they kind of just keep rolling and think that they're collecting every single dollar that's on the table. Well, they weren't. We came in, we looked at their foundation, learned all their people, learned their programs, their mission and their vision, which is very important to us.
Yes.
And we started to run the optimization tier, which is our favorite tier. We have the eligibility, implementation, eligibility, implementation, compliance, and optimization. Optimization is my favorite tier. It is when I came into Raven Consultants, I realized that most consulting firms only did compliance. I wanted to add on to that. My background is in finance. So I came from financial statement auditing at a CPA firm. So I'm able to not only do 340B, but I'm able to look at numbers and say the trends are here, the forecasts are here, the ROI is here, and say, let's operationally change this to make it better. So we did that with this client, as we've done with all of our clients, and within 5 months, they grew 34.5%. That's huge. Those are big numbers.
That's huge, yes.
So, and then they did something even better.
Okay,
and I love when they take the money and they do amazing things with it. They decided, with our assistance, to build an on-site pharmacy right there at the location.
Oh my
So
gosh.
you have thousands of patients coming in.
Yes.
Now they don't have to stop somewhere on their way home or forget. How many times do we just automatically go on autopilot and go home? They leave the doctor's office, they pick up their prescription, they check out. The patient navigator, who they also hired, is going to contact them to make sure that everything is okay. And I just love watching them grow. They were leaving all these dollars on the table from capture referral.
They didn't know.
They didn't know.
didn't know.
They don't have the time, though. And that's typically how it is in nonprofit world, is that you just don't have the resources. So hire a consultant. It really makes it worthwhile to hire a consultant, because although, yes, we of course do cost money, we have always found more money for them to pay us than we've actually charged. Always.
Jennifer, I'm so inspired on so many levels, because I don't know if you know this, but I have a nonprofit here in St. Petersburg.
Oh.
And we started in January.
Oh, very new.
Very new, but we're not even at our 18th month mark. And so a lot of organizations either fall apart or
Right.
they become a success story. And I went all in. I put everything into it. And that's what you do when you believe in something.
Yes.
And when I sit here and I listen to you talk about the possibilities and what you decided to go after, it all makes it worth the fight, because it reminds me that I'm not alone out here.
Absolutely.
That there are funds out there. Even when you think, no matter who's in office, no matter what's going on out on the televisions, that's all noise. It's distraction to keep you in your seat, to keep you locked up in your room, to keep you quiet about the things that matter to you, when you could be out there making a difference. And here you are doing it. And I think that's so cool, because there are a lot of consulting firms, but not all of them are handling or handing back money into the communities that need them.
Mm-hmm.
They're doing, X, Y, and Z. Okay, but your mission is to do just what you're doing, which is putting money back in the hands of the community that needs it the most.
Oh, absolutely. I did not create Ravin Consultants to blend in. I created it to disrupt the industry.
Yeah.
And that's exactly what I'm doing.
I think that will be trending after this airs.
Good.
Oh my God.
Because it's such a great program. And that's why I really wanted to do this. When you guys asked for me to do this, it was an easy decision.
Yeah.
Yes, absolutely.
Yes.
Not only to share the Ravin story, which I clearly love, but to advocate for this program, because yes, the manufacturers do want to either reduce it or restrict it or completely eliminate it.
Yes.
And we need to have more people aware about what is going on out there. This is not tax dollar driven. It is Big Pharma driven.
Yes.
They have the funds to pay for it. Let them.
Say that one more time.
They have the funds to pay for it. Let them.
Let them. Yeah. Well, and also, okay, so what do you do to get involved in order to figure out if you qualify, or what does it look like if somebody is hearing about this and they're like, well, wait, I want to get involved?
If they want to get involved, first, I would definitely research. And if you think after you're done researching that you might be eligible, contact a consultant. Calling a consultant as early as possible is the best thing, whether it's Ravin Consultants or anyone else, because unfortunately you can be duped into signing a bad contract in this industry. You could sign a contract with a pharmacy and they're going to charge you double fair market value, and you don't know what you don't know.
Yeah.
So contact someone to see if, one, you're eligible, and then two, really to set you up with the vendors who you fit with. There's third-party administrators out there for big hospitals. There's third-party administrators out there for smaller grantees.
Yes.
You don't want to be a smaller grantee going with a huge TPA when that's not necessary and paying all those fees associated with it.
Definitely
So
not.
the best thing would be to contact a consultant once you believe you're eligible for them to go through all those steps with you to protect you.
Yes, yes, yes. You've grown quickly, earning a spot on the Inc. 5000 list. What do you think has fueled that kind of momentum, aside from just you being you and all of the passion and purpose that you have poured into this?
That was a shock.
Yeah, well,
that was
that,
a
like,
shock.
oh, hi, good morning, by the way.
So out of 5,000, we ranked 1,640. So I didn't even think we were going to make it. But when we did and we made it to position 1,640, I was shocked. But it comes down to, we don't limit ourselves. We don't. Every single time a new adventure comes along, we learn it. And we start living it, and we start growing it and perfecting it. When I first started Ravin Consultants, I actually was Ravin 340B. And I was like, I'm so much more than that. I'm with operations and credentialing and charge masters and marketing and human resources to find the best positions for longevity. And I just was like, we need to do more than just 340B. We need to be Ravin Consultants. So I would say it's never limiting ourselves, consistently finding new pathways to new services, to how to give those services. Currently, we just started doing practice administration for organizations, helping them with some of those items I just mentioned, such as credentialing, charge masters, operational flows, scripting, electronic medical records. And we are already up to 3 clients putting in an on-site clinic for them or helping them grow their clinic. And we've now hired 2 practice administrators to work under Ravin because we found that that need was in demand. And now we're probably going to start promoting that even more. That come to us. We're more than 340B. We're 340B and beyond.
Yes, you are. Yes, you are so beyond. Oh my gosh. This is one of the coolest conversations I've had.
Oh, thanks.
I really enjoy just like your enthusiasm behind it. Clearly, you're very passionate about it, and it's refreshing to see. And that energy is, just it's palpable in this room right now.
Thank you.
Okay, let's talk about the dashboard. What makes it unique, and how does it help your clients simplify complex 340B program data?
Absolutely. So when I first started Ravin, it really was a one-woman show. And then as I started growing, I had to hire more Ravineers. And Rob, my current COO and principal, was one of my first Ravineers. And I told him, I need to simplify the reporting process. Being in finance, I am in Excel world all the time.
Yes.
And with the 340B program, you do have to work with these TPAs, third-party administrators. However, a lot of the big box pharmacies require you to work with their proprietary or partner TPAs.
Why would that be? Why would that be?
Money. So now my organizations are working with 3+ TPAs.
Okay.
So their CEO comes to them and says, run me a report on XYZ. It's not easy.
Yeah.
You have to log into 3 separate portals, 3 separate usernames, passwords, reformat everything so that it's in a certain way for your boss to see.
Right.
And then, of course, what's the boss going to say? Oh, well, let's look at this a little bit more. Go back in, pull all the reports, reformat it. So I wanted an easy, simplified way of integrating all of that data. So Rob and our IT created this proprietary dashboard for Ravin that brings in all the claim information from all your TPAs, no matter how many you have.
No way.
In a single use, you get to see all your different KPIs. You can look at month over month, provider over provider, which prescriptions you sell the most of, if the pricing is correct per the government. There are so many many different ways you can look at the manufacturer restrictions, trends, analyses. And being that we have grown to 17 Raveneers, I no longer am the lead on pretty much any accounts. So now I can go into that dashboard for every single one of my clients and see what they're doing and get with the lead Raveneer if I see something that's concerning to me. It has been life-changing for me internally, and just recently we started allowing our clients to use it externally.
What would you say to someone who's sitting in a similar situation, saying, I'm under all of these rules, I don't have the time or the flexibility to do the things I want to do. How do I make a difference? I mean, Jennifer, I can't. I've got bills to pay. I don't have time. How would I even start? What would you say to that person?
It takes perseverance. It does. Gumption, blood, sweat, tears. I hate to say it. It's not easy. When I first started Ravin, I went 7 months without my first income. I did. And it was difficult. So, I mean, the nails stopped, the hair stopped,
Yes.
everything stopped.
Yes.
I had to completely rebudget and focus on the prize. And I'm not saying it's for everyone, but if you're in an uncomfortable position, then it's time to change. Because what you just said, don't check the box that you have a job, a white picket fence, and then you die. Live your life. Live your life. Be a great professional, be a great parent, and be a great spouse or friend or whatever that other box is, and live your life. But it does require kind of starting over and finding that light and really heavily going after it.
It's not kind of starting over. I mean,
It
you are setting fire to everything you know to be true to say there's a whole other way to do it.
There is.
And Jennifer, you're doing that and showing others that it's possible too.
Good, I hope so. If that's what I'm here to do as well, then that's great. That's even extra added bonus to this then.
If that's not what life is about, then I don't know. Jennifer, when you think about the future of Ravin Consultants and connecting with the person at home that's watching this right now, if they're interested or they have a nonprofit and they're looking for money, what would be the way that you would suggest them to go about seeing if they qualify?
Sure. So I understand that a lot of the viewers who are watching this probably are not using the money for 340B. They are probably, in the Robin Hood example, they are the rich, the uninsured. And please know that you are helping the uninsured. You are being philanthropic and you don't even know it. And if you want to take that philanthropy and go even a little bit further, if you do have a healthcare nonprofit that you think might be eligible to be in this program and to bring in so many more funding and revenue to the actual organization and the community, absolutely reach out to Ravin Consultants to see if we can help you, because over the next few years, we are going to continue growing. We're already growing the medical practice administration portion this year. We're continuing to grow the dashboard. I'm very much so growing my staff to go into newer positions, and we're going to continue being the gold star legacy in this healthcare industry. So if you're looking to be a little bit more philanthropic or you think someone else needs some assistance with this, please contact us and ask when you go to your provider or the hospital if they are 340B, and if they are, which pharmacy you should go to pick up your prescription so you can help the community out as well.
I love that. Yes, bring it all back into the community. And also, like, when you think about Ravin Consultants and over the next few years, what gives you the most hope and excitement about the 340B program under what you've already been able to achieve?
I've seen the mind shift of leaders in healthcare go from it's a discount program to this is a lifeline. It is an absolute lifeline.
Yeah.
So 5, 10, 15 years ago, I think it was maybe the cherry on the sundae, but now it is pretty much the entire sundae of what brings in the revenue for their organizations or hospitals. So to see that shift in executives, and now they're out there advocating for this program and making more people aware about this program is what I really like to see about the future and the hope of the 340B program and its longevity. Just keeping it as it is right now is perfect.
Is there, if someone was sitting at home and they're still confused about 340B, what would you say to them right now? Just come to the website and look, there's information everywhere, or would you suggest that they look up the act, or what would you say to
I would not look up the act. The act,
Okay.
I've had to put it in layman's terms my own self because it's not in English. But I would absolutely look at ravenconsultants.com. We
Okay.
do have a couple vlogs on there, blogs on there,
Oh, cool.
diagrams on there.
Are there any other leaders doing what you're doing, helping
Yes.
nonprofits with the
Yes.
340B program? So you're not the only ones out there fighting on the front lines. There's many more that are trying to do the same thing.
Yes, and we're all individually different in unique ways, yes.
Very cool. If anyone wanted to follow your story across socials, how can we find you?
Oh, we're on everything, I promise you. Our marketing manager, Deanna, made sure that we're on LinkedIn and Instagram, Facebook.
Yeah.
We're on all of them, so you can find us at Ravin Consultants. Just make sure it's RAVIN.
That's right. Okay, before we wrap, this is something that we ask every guest on the Trending Today podcast. What's one value or mindset that you carry into your business, no matter what challenges come your way?
Integrity.
Mm.
Integrity. I mean, this is a federal program with lots of red tape, lots of hoops to jump through. It's ever changing. It depends on who's in administration. It depends on which manufacturers, Big Pharma, are going to fight us. So it's constantly changing. And each client is different too with what their needs are. However, it always comes back to integrity. We're going to do the right thing every single time, no matter what the noise is around us. And I think that integrity is not necessarily what only creates a successful business. It is what creates the necessary change in a business to make that impactful business decisions, impactful business success, everything to move forward. So hands down, integrity.
Integrity. Wow. Yeah. Yes. Absolutely. Yeah. Okay, Jennifer, thank you for everything you're doing to support healthcare organizations and communities. Your story is proof that when mission and margin align, real change happens. To our listeners, if you are in healthcare and looking to make the most of the 340B program while staying compliant and expanding your impact, reach out to Ravin Consultants. That's Ravin with an I, RAVIN consultants.com. This has been the Trending Today podcast. I'm Lauren Hubbard. Thanks for tuning in, and we'll see you next time. Thank you so much for being here.
Thank you for having me.